Welcome back to Live at 9. And when I brought up this topic to Dr. Quinn, he was like, oh, I love working out. That's my favorite thing to talk about. Except we're going to take the bad side of it because, you know, there's a lot of health benefits, but then there's some problems that occur. What are some of the most common injuries that you see from people that work out when they come to you as a doctor?
Right. Well, here's the deal. I serve as a family doctor and a doctor to help people get to a healthier weight. And in a lot of cases, I'll prescribe medications, but I'll also prescribe lifestyle changes, which include exercise and diet. Some people, they'll start exercising, but they'll do too much. They'll come back and say, Doc, I hurt my knee or I hurt my ankle. But what I remind them is listen to your body. If it hurts really, really bad, and then I'll do an exam. And if the exam is indicating that they need an x-ray or a referral, I'll do that. But usually I'll give them like a non-steroidal anti-inflammatory such as Advil or Motrin for a few days and just see how it goes. But the most common problem I see are musculoskeletal strains or just injuries, which can subside over time.
Yeah, so I guess, is there one specific one? Does it tend to be the knee? I mean, is it the back? I mean, is there anything specific?
Well, the knee is the most common because a lot of people get out there and they try to walk, but maybe they haven't walked before, or maybe they'll try to run. I advise just start out walking and see how it feels. And if you have no pain after about a week, then you could do a little trot. And if it doesn't cause you any pain, then you can maybe try to run. But start slow and work your way up and listen to your body.
At what point does someone need to actually go to the doctor with an injury? Because sometimes I'll have a little pain and I'll go, okay, this hurts a little bit, and then the very next day it's gone. So maybe I didn't need to go right into care and it ends up going away. At what point does someone actually, okay, you felt pain for X amount of time, or it hurts, you know, pain level 7, like how does someone go into Dr. Quinn and say, okay, it's time to check this?
Well, here's the deal. You want to look for swelling, mobility, like can you move it? If you can't move it, if it's so swollen you can't move it, I say go ahead and go see your medical provider so they can decide, you know, if you need an x-ray or an MRI or a referral to an orthopedic doctor for more intensive evaluation and immediate treatment. So just listen to your body. If it's really bad, then, you know, go ahead and get checked out. But if it's not, don't, you know, just give it a couple of days, maybe try some over-the-counter anti-inflammatories like Advil.
This is going to sound really funny, but I know that it happens. Do some people sometimes confuse sore with an injury? Like, oh, my bicep is sore, but they think, oh, I'm hurt because I'm having a tough time, because, you know, they may not be familiar with working out.
Now, that happens all the time. We get a lot of patients that come in that are super duper motivated. They'll go to the gym and they exercise like really, really hard, and then they'll have those aches and pains. Sometimes they'll call the office, but we'll do a survey over the phone and we'll just assess what level of difficulty they're having. And if it doesn't sound bad, we'll advise them, as I said earlier, to maybe try the Advil or the Tylenol and just give it a couple of days and then we'll follow up. But if it hasn't got any better, then we'll bring them in and do an in-person evaluation.
Is there a certain type of medicine that's best that's over the counter if you do not have an injury that you need to go to the doctor for?
Most definitely. The anti-inflammatories, if your stomach can tolerate them, but don't take them on an empty stomach. And that's your Advil, ibuprofen. These are non-steroidal anti-inflammatory medications.